the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the June 19th, 2017 meeting of the Shawnee County Board of Commissioners. My name is Bob Archer. I currently have the honor of serving as chairman of the commission and representing District 3 alongside Commissioner Shelley Bueller, who represents District 1, and Commissioner Kevin Cook, who represents District 2. Good morning, everyone.
Good morning.
Welcome. First item of business, please.
Number 1, proclamations, presentations, update on Vallejo Behavioral Health Care, Inc. Bill Percy, your CEO.
Thank you, Mr. Commissioner, Commissioners Cook and Bueller. We appreciate the time here in front of you today. We'll make a brief report. I do apologize that the net fund income statement, the financial statement, just came in this weekend. Our Chief Financial Officer, Angie Haggard, was working on that late Friday and early Saturday, and I got it on email this morning and burned you a copy, so it should be there. And I might address that here in just a second, but first to let you know that our 2016 fiscal year, calendar fiscal year audit will be due to the board next week. I imagine they will adopt it, and then we'll get a copy on down to Jane and Betty, so that's there for the record for your review. The Mental Health Center will make an annual report to the County Commission in satisfaction of statute KSA 19, I think it's -4007, but we are honored to make that report just regardless of statute. We have a strong belief that the county, as our oldest partner and customer and mission supporter, need that information, so transparency is what we're aiming for. Anyway, that should be up fairly soon. The board will review that. The executive committee of the board will see that today, and then if there are any revisions, the board will see it next Monday. We'll get it to you right away. It's going to be a very simple report. In the past, we've had quite a bit of newspaper space devoted to that, but we're just trying to trim back a little bit. So we will send you that report. It's open to the public. Anyone can view it, and there's always more detail there. If you want that, I'd be glad to provide it. Also, so for May 31, the unaudited net fund income report is there. We had pretty good months in March and May. April was kind of low, but it leaves us at a point where we're about minus $216,000 for the period ending May 31, 2017. If you reduce that to operational days figures, like I often do, it's about $60,000 a day to run the mental health center. So we're behind, 3.5-ish, 4-ish days, and you never want to see negative figures, but we think that's a number that, given our tough last couple of years, really all over the state, for a lot of healthcare providers, we consider that holding our own. We look for improvements now that the Medicaid rates will be restored on July 1. If you'll permit some very, very broad forecasting and not hold me to it, we think that'll bring in $500,000, maybe a little more, that we've lost in the last year. And so had that money been there, it would have been about, I'll just say $40,000 a month. And if you take 40,000 times the first 5 months of this year, we would have been just about breaking even had those Medicaid rates not been cut. We'd have been way farther ahead if some grants hadn't been reduced and some other things that have happened. But we see some of those building blocks being put back in place, and we thank the legislature, and the governor for their support of mental health, and we have some more work to do, some more gaps to fill, particularly in the area of crisis care. Thanks again to the county for being there with us for more than 50 years. You folks have, again, I can't say often enough, have created that cornerstone for us. I'll pause for questions, comments, and also to introduce Mike Wilson from our governing board from Architect One. I think Mike's the only member of the board we have out there right now. So Mike is here representing the citizens.
Okay. Questions for Bill? Looking at the report, and I know you've been real proactive in reducing expenses at Vallejo. Can you tell us a little bit about that and how it's impacted services?
Sure. Well, we knew that in late 15, in fact, all the mental health centers knew that There was talk of a rate reduction. There was a Medicaid contract a piece of our Medicaid contract that we knew would probably be going away, and so we had some time to prepare for that. But that really became acutely aware of that in January and February of 2016. So we assembled a team, we assembled a board, we made quite a few changes in Vallejo. I could give you a few examples, and there is some written documentation to create a history there, but we eliminated some management positions and consolidated some other positions. We added to caseloads. We did quite a few things, went out and sought more small grants and, to kind of fill gaps in between programs. We did quite a bit and shaved off hundreds and hundreds of thousands of dollars of expenses in calendar 2016, and kind of broadly referred to that as our austerity plan, but try to be more positive. We now have a third or fourth iteration of that plan that we're calling a plan for financial success, opportunities, and efficiencies. And so that effort to save money continues. One of the more recent ideas that the board is considering is maybe a vacation buyback, and we haven't spoken a lot about that, but maybe we actually think we can have a win-win situation there with the staff and with the budget. So we're just looking at a lot of different things we can do to make money and save money, and have been blessed with a contract at the county jail, thanks to Director Cole and his team, which brings alcohol and drug abuse services there. We are talking about maybe we can get some employment preparation services for inmates at the jail and help prepare them for successful release. So we've been working with JUMP on that, and I think you'll see that as a part of our budget proposal for 2018 coming on. But, Mr. Chairman, just a lot of little things and some big things. The Women's Fund, the Topeka Community Foundation gave us some money for our support education program, several $1,000s. It goes a long ways, and a little money from the Arts Council, just $500 here and $5,000 there. We're trying to step up our fundraising efforts, but just lots of ways to, I don't want to say cut corners, but just be efficient and smart about the way we do business. So even though we hope some better times are on the way, we want to continue our practices of careful financial and planning and be good stewards.
I'd like to publicly applaud your cost-cutting efforts and leadership at Vallejo. The results are very impressive. So.
Well, I'm surrounded by excellence, including you folks, so thank you, Bob. I appreciate that.
We're happy to be partners.
Thank you.
Commissioner Cook? Yes.
I know it's a little bit premature. The budget hearings are coming up in a month, but I expect or look forward to, during the budget presentation, some discussions about what impact the cuts the city of Topeka is proposing as it relates to Breakthrough House and some of our mental health partners. We think about Vallejo, but we have Family Service and Guidance, we have Breakthrough House, and so we have multiple partners that represent mental health. So during the budget process, how the cuts from the city of Topeka will impact mental health services and how the county is going to respond.
We'll be watching for that, and we'll be prepared for that, Commissioner. Thank you.
Commissioner Cook. Commissioner Bueller?
And that budget hearing is July 19th, I believe, at 11 a.m.?
Yes. We were originally scheduled for the week prior. We couldn't get everybody here, and Jane was kind enough to be flexible with us, so we do appreciate that. So we are looking forward to July 19, 11 a.m.
Good deal.
Okay, very
Great.
good.
Thank
Very
you.
good.
Thank you.
Did you want to continue, Bill, anything?
Sure, I can cover these items pretty quickly. I know you have a full agenda today, and probably addressed the first three already. State funding and Medicaid rates, I believe I touched on that. We do think that because I believe it comes from a piece of legislation that creates, I believe it's a 4% privilege or provider tax on certain health insurance companies that would provide additional revenue for mental health. We think it may restore several $1 million worth, statewide, several $1 million worth of state base mental health grant funding that's been around for years, and actually hasn't been around for years. It was around for years. The mental health center suffered a $22 million cut in grant funds over the last roughly 9 or 10 years. This piece of legislation and the funding goes along with it begins to put that back in place. Maybe upwards of $7.5 million. And so I'm assuming that each of the mental health centers would have some portion of that money returned to them in some way, and that'll be something we'll work out with the state. So we do look forward to that. The Crisis Intervention Act, which I provided a copy of, is interesting reading. It provides for the safe and secure psychiatric treatment at the local level for people up to 72 hours, and hopefully it's a chance to keep people out of the state hospital and help people begin their recovery sooner without a really significant intrusion into their life. It's pretty amazing what people can do in 2 or 3 or 4 days to get back on their feet when you can apply medication quickly, when you can rally up family support and surround a treatment team. It's amazing how quickly people can bounce back and get on with their lives. So we hope to accomplish that through the Crisis Intervention Act. Try not to refer to it as the CIA, but people are calling it that. And then I want to let you know that Vallejo was re-accredited by the national group, the Commission on the Accreditation of Rehabilitation Facilities, for another 3 years. I think we have 4 relatively minor policies and procedures to change as a result of that audit, which was, I believe, back in April. So with that, I would stop my comments if Mike has anything to add, or if you have any other questions. Our time is yours.
Any additional thoughts?
No.
From Bill?
You
Commissioner Bueller?
didn't talk about the fundraising event on October 7th. You might mention that, just
Thank
for
you.
people to get it on there.
Thank you so much. We're getting some nice corporate sponsorships in for that. I think over half the tickets are sold. They're priced at $75 a piece. And we're hoping for a crowd of around 150 or so people, and most of the event will be focused up in Noto on Saturday, October 7. And Vallejo has not had, until this time, a signature annual fundraising event, so we wanted to create something that, we didn't want to step on anybody else's toes, and some great fundraisers around town. And so the son of former President Gerald Ford, Mr. Steve Ford, who's a renowned actor, will be the keynote speaker. And so we're going to have kind of a celebrity art auction, celebrity meaning like local Topeka, Shawnee County celebrities who will submit art, and we'll auction that off hopefully at really high prices, and use that money for our foundation. So thank you for reminding that. Saturday, October 7.
Yeah.
Very good. Thank you so much, Bill.
Thank you, Mr. Chairman, Commissioners.
Thank you.
Next item of business, please.
Item 3, consent agenda.
There are 3 items on the consent agenda. Are there questions or comments?
I have none. I'll move approval.
Second.
Motion made to approve the consent agenda by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item 4, new business. Item A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $874,439.51. The highlights out of that voucher report: payroll, $527,862.28. Health insurance premium, $114,287.40. Workers' compensation premiums, $43,157.93. And Parks and Recreation over various accounts, $88,167.32. I do not have any questions regarding the vouchers and would move for their approval.
A second.
Motion made to approve the vouchers by Commissioner Cook, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item A2, consider correction orders.
Move approval.
Second.
Motion made to approve the correction orders by Commissioner Bueller, seconded by Commissioner Cook. All in favor say aye, opposed say no. Motion carries 3-0. Next item, please.
Item B, corrections number 1, consider approval of request to reclassify licensed master's social worker position from a range 13 to a range 15, increasing the starting hourly pay rate from $17.77 and to $20.54 an hour, resulting in a total financial impact for fiscal year 2017 detention budget of $39,010.74.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. I'm coming before you today to request approval to reclassify our social work positions. One of the things that back in January or late last year or in January this year, the Board of County Commissioners approved us to add another social worker to our mental health team to help us with our efforts with dealing with those deal or suffer with mental illness while they're incarcerated. At that time, or since Up from January to today, we've had one applicant at that time who did turn us down. Part of it was money was the issue. And so I started doing a little bit of research into the impact of where we had our position classified. And one of the things I did speak with some people at Vallejo, and I did speak with our Human Resource Department, and started talking to them about, do we have two classes or classifications when it deals with social work positions? Our social work positions are master's level social workers, and where they were placed on the scale were those who deal with just a bachelor's degree. And we found out that there is a position, or there are a level of a classification in the county for those who specifically are master's level social work, when they found out they were drastically paid more than where we had ours. And so I did speak with Jim, the interim Human Resource Director at that time, talking about that, and I think we both acknowledged that this was something that we needed to change, because we do have the existing classification. We're not creating something new. We do have the money budgeted in our funds. One of the big reasons is because we haven't been able to fill it, the position. And I am confident that if we are able to fill it, we will more than enough have the money and the funds in the agency to be able to do this. This is just for the remainder of the year, because we will be back next month with a proposal to negotiate with a contractor for our mental health. But so this is just for the rest of the year. We are one position down, and I have a social worker who's retiring in August. And this Ben has been with us, I'm going to guess, close to 30 years. So we're going to be two people down, and we've got to get this filled. So that is the request I have before you, and I'll be happy to answer any questions you may have.
Questions or comments for Brian?
No, I have one.
I'll move for approval.
I'll second.
Motion made to approve by Commissioner Cook, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Thank you.
Thank you very
Brian.
much.
Next item, please.
Item C, Health Department, number 1, consider authorization and execution of contract C209-2017 with the Kansas Department of Health and Environment for mosquito surveillance and educational materials, with funding for $10,000 from the KDHE Bureau of Epidemiology and Public Health Informants from July 1, 2017 through October 31st of 2017.
Good morning, Commissioners. Ed Kalis with the Health Department. The Health Department is already committed to doing mosquito surveillance work with the Kansas Department of Health and Environment. We actually started without this contract in the middle of May to begin the mosquito season. What this contract allows is to have KDHE help us to do that work. We are using environmental health staff and MRC volunteers currently, and our intention was to do that the whole mosquito season, but this helps augment our funding to be able to do it at a much less cost for the tax burden. So if you have any questions, please let me know.
Questions? I'll make a motion to approve the contract.
I'll second.
Motion made to approve the contract by Commissioner Archer, seconded by Commissioner Bueller. All in favor say aye, opposed no. Motion carries 3-0. Thank you, Ed.
Thank you.
Next item, please.
Item 5, Administrative Communications.
Good morning, Commissioners. Randy Luby, Parks and Recreation. Just a reminder, Thursday, June 22nd at 1 p.m., we have a ribbon cutting ceremony for the trail extension for Shunga Trail. Refresh your memory, this is the part of the trail that goes underneath I-70, or excuse me, 470 and 29th Street. Again, that's at 1 p.m. on June 22nd. The best parking for this is off of Southwest 28th Court. If you remember where the old bowling alley was, drive as far as you can, park there, and we'll have a short little commute for the ribbon cutting. Also, I'd like to point out this past weekend at Lake Shawnee, I had the pleasure of being able to work it, I guess you could say. I didn't do a whole lot, but I was there for the Topeka 10-man triathlon. We had over 500 athletes and probably another 300 spectators that came out early in the morning. And as I was leaving, I noticed, drove around the lake completely, and we had every baseball field was utilized. We had a softball tournament going. They were all utilized. The Lake Shawnee Golf Course had a major tournament going on. The campground was full. Every shelter house was rented. Now I see why Expedia voted Lake Shawnee as the top destination point. It was a busy weekend.
Good.
Thank you.
Excellent, excellent. Thank you. Thank you, Randy.
Good morning, Commissioners. Justin Gregory, Kansas Expo Center. Just like to say it's good to see everybody again, and also provide a update on the Equine Center at Dome Arena for the remainder of the year. Last weekend, we had Ann White and the Kansas Hunter Jumper Association had their annual show. Again, very strong turnout, and everybody was very pleased. This Wednesday, we welcomed the 4-H group with their equine clinic for Wednesday evening, and then we turn around and Friday morning welcome the Kansas District 9 National Bell Horse Racing Association 3-day event in Dome Arena. Soon as that is over on Sunday evening, we will start prepping for Monday morning installation of our low-speed, high-volume fans that were recently purchased. They have arrived, and we actually have our last open weekend in 2017 is the 4th of July weekend. We had July 29th and 30th open, but I booked that recently, so this is the last weekend we have open in the year until Christmas. So we're going to try to get those fans up, and Saturday, as warm as it was, we sure could have used them in there. Do appreciate the support we've been given. The equine community and I look forward to continuing our momentum that we have built in 2017 on to 2018 and beyond, and doing what our part is to offset the subsidy that the Shawnee County provides to Kansas Expo Center.
Excellent.
Thank you.
Thank you, Justin. Any other discussion in administrative communications? Commissioner Bueller?
Bike Across Kansas came through. There are a few challenges with heat and with storms and everything, but I think overall it went pretty well.
Yeah,
So,
was. Commissioner Cook?
Nothing today.
Nothing more on the city of Topeka?
No.
Good. I don't have anything. Next item, please. And we're going to do something sort of different. We've got the Board of Health meeting is coming up, and we do need to have an executive session. So procedurally, what we're going to do is go into recess to have the health meeting, and then we're going to come back into regular session, go into executive session, come back into regular session, and then adjourn. I know it gets complicated, but the county councilor assured me that's the way to do it. So, and I do hope people stay for the health department meeting, the health board meeting, because essentially one of the highlights is going to be the county health rankings, which is a concern to all of us, and we're going to talk about that moving forward. So I'll make a motion to go into recess to talk about the health board meeting.
Second.
Motion made to go into recess by Commissioner Archer, seconded by Commissioner Cook. All in favor?
do we have a question? We have to allocate a time or not? No?
Might be a good idea, though.
Okay. Go into recess for 1 hour. Commissioner Cook seconded. All in favor say aye. Opposed, no. Motion carries 3-0. We're in recess and convening the Board of Health meeting.